Hi, my name is Jennifer Courcelle, and today I'm going to talk to you about the integumentary system. The learning objectives for the class are: number one, the student will be able to identify parts of the integumentary system. Number two, the student will be able to assess normal geriatric skin changes. Number three, the student will be able to practice prevention strategies and provide nursing education for skin tears and pressure ulcers to decrease the risk of infection. The integumentary system consists of hair, nails, skin, and subcutaneous tissue. The primary function of this system is to provide protection, sensation, thermoregulation, and vitamin D synthesis. The skin is the largest external organ of the body and consists of the epidermis, the outer covering or top layer, and the dermis, the layer containing vascular tissue, sweat glands, sebaceous glands, and tactile receptors. One of the most important aspects of nursing care is maintaining the integrity of the skin. As we age, physiologic changes occur in the integumentary system. They are known as intrinsic factors caused by internal processes such as loss of subcutaneous tissue, decreased tone, loss of elasticity, wrinkling, decreased oil secretions, dryness, increased bruising, skin tears, heat intolerance, developing age spots, and decreased melanocyte production, turning hair white or gray and becoming more prone to sunburn. There are also extrinsic factors as a result of environmental causes such as tobacco smoke, alcohol use, climate influences, and exposure to sun rays or ultraviolet light. These changes increase the risk of infection. The epidermis and dermis become thinner, leading to skin tears, opening a portal of entry for infection. Skin tears occur when the epidermis and the dermis are separated from each other. Cells are not replaced as quickly, leading to slower wound healing. Subcutaneous fat diminishes, leading to decreased cushioning for protection. Decreased number of capillaries leads to diminished blood flow and supply that is essential for wound healing, providing oxygen, nutrients, and white blood cells to promote healing. Decreased activity of sebaceous and sweat glands leads to drier skin that is more prone to irritation. Let's explore some common geriatric skin issues in nursing care. In nursing care, we are concerned with the changes in the skin integrity and must take every precaution to eliminate breakdown and to promote healing of the skin. Some common problems include xerosis, drying, fissures, cracking, and pruritus, itching. Pressure ulcers are problematic chronic wounds produced by pressure on the skin and tissue due to excess intensity and duration, usually found on or near bony prominent areas. Immobility increases the risk for pressure ulcers. Patients who are bed or chair bound are significantly at risk. Nursing care. Assessment. History, comorbidity, previous pressure ulcers, and medication. Inspection. Color. Is there blanching or redness? Hygiene. Is the skin intact? And moisture. Palpation. The temperature of the skin. Is it warm to touch? And what's the texture of the skin? Staging is the classification of pressure ulcers. Stage 1, non-blanching erythema or redness. Stage 2, partial thickness skin loss of the dermis. Stage 3, full thickness skin loss in subcutaneous tissue may be visible, but bone and tendons are not visible. There may be undermining and tunneling noted. Stage 4, full thickness tissue loss with exposed bone, tendon, or muscle. Unstageable, depth unknown, as the wound is covered by slough, which is a yellow, tan, green, gray, or brown, or a scar, which is black, and until the covering is removed, the depth is unknown. Suspected deep tissue injury, depth unknown, purple or maroon localized area of discoloration, skin is intact, which is mushy or boggy. This common issue of the skin is caused by a number of reasons. 1. Bedbound patients must be turned and repositioned hourly. The most common areas of pressure ulcers are primarily the sacral and coccyx area, followed by the heels. 2. Device-related pressure ulcers. One must be aware of equipment such as things like tubing, cords, and elastic. Locations to watch closely are the ears, sacral and coccyx, heel, and buttocks. 3. Surgery long waits usually are unexpected, and the patient needs to be repositioned or reminded to reposition themselves if able. Prevention protocol interventions include skin care, avoiding moisture and friction, pressure redistribution, repositioning, and nutrition. Another common issue related to incontinence-associated dermatitis. The body's pH of 4 to 7 is necessary to keeping the skin intact for protection. Both bowel and urinary incontinence presents challenges to maintaining the natural barrier skin provides. Irritation of urine due to its alkaline properties or damaging to the skin, as well as fecal matter, both overexposing the skin to moisture and chemicals. Incontinence, nursing care, and prevention of skin breakdown. If diapering a patient, then provide frequent diaper changes to eliminate exposure to moisture. Routine skin care use such as a barrier product applied to the skin to protect it from the damaging effects. Timely, gentle cleaning is a must, applying moisturizer to dry skin and assist in mobility if possible. There are some health promotional strategies essential to promoting proper skin care, and nursing education provides the information necessary to maintaining a healthy integumentary system. Nutrition and hydration. Proper diet and nutrition is important to healthy skin. A diet high in protein and adequate hydration remains critical to the equation. Consult a dietitian for nutritional status issues. Encourage intake of water and food. Assessing patients for unintended weight loss. Dietary intake issues such as decreased appetite, problems in eating and swallowing, lack of resources and inability to cook due to disability or financial difficulties, and evaluating laboratory values including comprehensive metabolic panel, serum albumin, and prealbumin. Hygiene is vital to the prevention of breakdown. Patient education. Advise your patients to take fewer baths or showers to prevent drying the skin out. Moisturize dry, itchy, wrinkled skin, and using emollients and lotions to the skin enhances the skin barrier function. However, do not add oils to the bath water or after showering because it increases the risk for falls. Keep skin clean and dry. Prevent falls, injuries, and trauma. Use sunscreen and protective clothing when exposed to sunlight. In conclusion, there are many changes that occur in the geriatric population, and the integumentary system is no exception. These are physical changes that are an outward sign of aging. This system is an indicator of a person's general health and should be one of the first systems you assess in determining the patient's overall health and well-being. Compromised skin integrity can lead to serious infection and eventual loss of life or limb.